My name is Angie Hawthorne. I'm a clinical nurse expert here at Children's Healthcare of Atlanta at the Scottish Rite Neonatal ICU. If you're watching this video, chances are your baby's been admitted to our NICU. So I wanted to show you some different aspects of our NICU and explain things so when you come to our NICU for the first time, it'll be a little bit less anxiety producing. So welcome to our NICU. We are glad you're here. I always say you're in a great place with fantastic people. They're going to take really good care of your baby. So I'm going to go ahead and enter the NICU. So our NICU, you press that doorbell, which you'll see right here. You'll give the secretary answer the doorbell.
Can I help you?
Hey, this is Angie, and I'll be coming into the NICU now.
Okay, Angie, what baby is yours?
Let's see, if I had a baby, I'd be letting them know the bed space, so there'll be bed space 3.
Come on in.
Next, I'd like to introduce you to people that you're going to see early on in your mission. And first, I would like to talk about our neonatologists. So we have a group of 4 neonatologists that will be taking care of your baby. Generally, each baby has 2 primary neonatologists. Their typical work schedule is 7 days on and 7 days off. That is just a great way for them not only to get to know you, but to really get to know your baby. So we have Dr. Spafford, Dr. Anderson, Dr. Sisson, and Dr. Kapasi. But we're also incredibly fortunate to have a team of neonatal nurse practitioners that will also be in on the care of your baby. And so depending on their assignments, you may be talking to a neonatal practitioner during the day also. I will let you know overnight, our physicians live very close by and can be in here in a few minutes if we need an emergency, but we do have a neonatal nurse practitioner that is here all night. So you may get a call from them if there's anything they're worried or concerned about. So your baby is seen during the day by the neonatologist or the neonatal nurse practitioner. If you're not at the bedside, they're going to call you on your cell phone and give you an update. So you may want to be prepared with some questions that you may have. If you don't pick up your phone, they will leave a message on your answer machine with the update, and you are welcome to call at any time if you have some questions or concerns. Next, I want to talk to you about a whole team of people to support you while you're here. So just to name a few, but we have 2 social workers that work here in the NICU that are here to support you for all kinds of needs that you may have with your job, with insurance. We have our chaplain that will be here visiting with you about your support and emotional needs. The world's best lactation consultants that really know the special concerns that NICU families have when they're pumping breast milk. I'm here as a clinical nurse expert that will be rounding on you and asking questions and making sure that you understand everything that's going on. We have a discharge coordinator that will be helping you get prepared for when your baby goes home. Our case managers that will be working with your insurance companies to make sure you have all the equipment necessary if your baby's going home with that. Child life specialists that will work with you and really your whole family about the dynamics of having a baby in the NICU. And then our developmental care specialists. They are a fantastic group of people that are really going to be working with you and making sure that all your baby's developmental needs are being met. So they'll be working with you and your family, teaching you ways to help your baby be able to reach all its developmental milestones. So this is a large portion of people that support you, but there's really even more I couldn't even mention because there's so many here. Early on in your stay, we'll be reviewing with you the parent participation guidelines. So paper just front and back, and then we'll have you sign it after you read it. But this kind of goes over really all the nuts and bolts of having your baby and visiting them and being with them in the NICU. So the first thing I wanted to let you know is the phone number, how to reach us is here on this page. But then also your baby has a 3-digit code that we're going to ask for you to verify that you're the parent when you call to get an update on your baby. You can call any time of the day or night. I always tell families that we're going to call you if we're worried or concerned about your baby, but other than that, you can call us anytime, especially if you're up in the middle of the night and you're worried. It is certainly fine to call us. We're just going to ask you for that code. When you come in, we're going to give you the mother and the father will have an orange band. That band will help expedite you through security when you're coming into the hospital. Also, we'll get you a discount down in the gift shop, the coffee shop, or the cafeteria also. So we love having parents at the bedside, especially participating in their child's care, but there are a few times when you may not be able to be at your baby's bedside. So one time is if we're doing surgery in our unit or a baby is not doing well, we may ask you to wait out in the waiting room until the coast is clear, and then we can have visitation again also. We ask you, please don't come and visit if you're feeling unwell in any way. So a fever, a cough, if you don't feel like yourself, we know our babies have a very immature immune system, and it's easy for them to catch things. So it's going to be very important. We do the same thing too as staff. If we're feeling unwell, we do not come into the unit that we ask that about you also. We do have quiet time on our unit from 1 to 3 a.m. and 1 to 3 p.m. when we try to keep our noise level very low, giving our babies more time for that restful sleep. Currently in our NICU, the only visitation is with the mother and the father, or if we only have one parent involved, there may be a secondary caregiver parent. That may change in the future, but currently that's where we are for visitation. We do have an important safety step every day. It's shift change. So when night shift comes to day shift, or day shift is leaving and night shift is coming on, that's from 6:45 a.m. or p.m. to 7:15 a.m. or p.m. If you're in the unit already next to your baby's bedside, that is no problem you staying through that shift change, but we just ask you during those times not to come or leave. We know this is an important critical safety step. Distraction from families coming in and out or asking questions during that transfer of care can be very distracting, and we don't want to leave out any important things about your baby. If you live far away or do not feel comfortable going home at night, we either have a sleep room around the corner from here, or if you're over 50 miles away, you have the option many times of our Ronald McDonald House. A social worker is going to come and talk to you, explain our options if you need them, and then sign you up or show you how to do that also. So your baby's bed space, we love to have family pictures here. We usually put them right up here. It's great for us, staff, to see the family, but it also gives us some talking points when we are caring for your baby that we'll be talking about their family members with the baby also. So you're welcome to bring that. We just ask that you don't bring any valuables at the bedside. So those are kind of the highlights of our family participation guidelines, but that'll be gone over with you in depth from me too. Another very important thing to us is your patient safety. Many of our babies have IVs in their hand, or sometimes central lines, or a more permanent IV that will last longer. So we're going to be going over with you the safety steps to keep your baby infection free. And so these cards will be at your bedside. We'll be going over with these also, but knowing that safety is really our job, because we want to keep your baby safe and infection free, but also your job also. So if there's ever a time when you're worried or concerned and feel like, gosh, I didn't see that person wash their hands, or typically they have gloves on when they're doing that, always speak up. We're all working together as a team to keep your baby as safe and infection-free as possible. So especially when it comes to lines, but really make sure that you speak up and ask questions, because parents are a huge, important safety part of caring for your baby. We developed a notebook called My NICU Journey, and really and truly, this is every bit of information about your baby's NICU stay here, starting really from the very beginning and things that we're looking at and concerned about, pain control, things about the isolate, We talk a lot about breast milk and how breast milk is really medicine for our babies here, about pumping, about what to eat. Pretty much everything you can imagine about having a baby in the NICU is in this NICU Journey Home notebook. Now we keep this notebook at your baby's bedside. This is for you to read while you're here. Also, we're going to be adding information to the notebook also. So let's say that your baby's going to go home on a specific medication. We'll put that medication sheet inside your notebook. So when you go home, this notebook goes with you and you'll have that information also. Also in the notebook is phone numbers of how to reach social work, chaplain, me. You know, if you have questions or concerns, our direct numbers are in there too. So while you're here, make sure that you look through your NICU Journey Home notebook and read it along the way, and it's going to help step by step guide you through your baby's care. You are a very important part of your baby's NICU journey, and so we have lots of things in place to be able to help you with that journey. And I'm just going to show you some of the things, but all of our babies have a NICU journal. We write in it as a NICU staff, so if something happens during the day and your baby does something, you're not here, we'll write about it in the journal. But also this journal is for you also. You can write down a note for your baby or something happened. We also have a camera in our NICU and we print off pictures and put them in here also. So if you don't see it at your bedside, it should be there. Just ask for your NICU journal. We have had several families that have filled up and have gone through a couple of them. That is no problem at all. We have a stack of them for you. We also have the Beads of Courage program. So this is a program for babies that have more of a long-term stay here in the NICU. Each bead represents a part of the journey for that NICU baby, so this is a voluntary program. Once your baby's here several weeks, a nurse will be talking to you about the program, giving you information. It is free of charge, but this is a way that you can really kind of signify your baby's journey with each bead. So I have a long string of beads. The baby's been here for several months, but each bead color, each bead shape represents something from the baby's journey. So we get the most incredible pictures of babies after they've been discharged from the NICU with their beads of journey on. So it really is a fantastic program, and if you qualify, it's well worth writing down everything the baby's gone through so we can get a bead for that. From a developmental standpoint, we know how important it is to interact with your baby. That your baby's brain is growing at such a rapid rate, and we know babies hearing our speech, singing, reading to your baby really makes a difference in their developmental care. So we have a whole library of books here. You can pick out your favorites, have them at the bedside. But when you're interacting with your baby, it's so important to talk to your baby and then also reading to your baby too. So we do have a reading log that we keep, and we tally the amount of time that we read to each baby. It's so exciting at the end of the month to get your tally of how many hours sometimes your baby has been read to. So that part is very exciting too. We really encourage it. We do have a lot of great books in our library for your baby to be read to. One thing I'd like to talk to you about that we know there's so much scientific evidence is how much kangaroo care or skin-to-skin care is good for our babies. Not only is it good for our babies, it's fantastic for our parents also. So we know babies that experience kangaroo care can gain weight faster, experience less pain. Moms can make more breast milk, have less feelings of anxiety and sadness. So as you can imagine, all around kangaroo care is very, very important. And really almost like medicine here too, like the breast milk. So we have a kangaroo care video for you to watch. And I love the video because it really kind of, you get to see someone else doing it, so you can really visualize, especially if your baby has a breathing tube. It can be very intimidating. So what we would do is we have hospital gowns for you to put on. You can remove your shirt, you keep your bra on or take your bra off. It's totally up to you. And then we have this this, I like to say, tube top that you put on and you zip it up the side. And actually what we do is open it up and slide your baby inside of here. We have this really comfortable chair. The legs come up. We can place the baby in your arms. So before kangaroo care, we usually say, have you eaten? Once we get the baby in your arms, we like to have them stay at least an hour. And so to make sure you'll be nice and comfortable too, to go ahead and use the restroom ahead of time. So we'll go over that video with you. So just what it'll look like with the top. Moms, dads, we love for both of them to do the kangaroo care, and we really know that it makes a difference in both of y'all also. So I just brushed a little bit about the NICU and what an incredibly stressful place this is for you. And we really do recognize that, and we have resources for you. So the first thing I want to say is please speak up. If you have feelings of sadness and anxiety, and you're really unsure, that we know that these are normal emotions to have in the NICU, that many NICU families have a lot of anxiety, sometimes postpartum blues, sometimes postpartum depression. It's very important that you speak up if you are feeling any of these symptoms, and we'll be talking to you about it also. Or maybe you just may come in someday and you have, gosh, my anxiety level is so high. Please let us know so we can offer that support to you, knowing that that is just part of being in the NICU. You are not alone here, and we want to make sure that we support you in any way possible. Next, I'd like to talk to you about breast milk. We know in the NICU, breast milk really equals medicine. Breast milk is something made by the mother exclusively for her baby that provides immunity and immune properties that can really help your baby. So we highly recommend it. I know it's really tough, and we got some great lactation specialists that will meet with you, and they'll even probably give you a call at the birth hospital to help you with any problems you may have. If you have any problems pumping. Anything that you pump from the birth hospital, we would love to have here as soon as possible. Oral care with breast milk is very helpful for your baby. So any drops that you pump out, we'll be using to swab the inside of your baby's mouth. And that also is something that you'll be able to do once you get here. So we have a process for the milk that you pump. We have a specialty label that will have your name, information on there. So it'll be important that you fill out the label of the date and time that you pump it, and then we'll be placing the breast milk either in the refrigerator or the freezer, just depending on how soon. So we have snappy bottles. So this is our pumping room. So we have lots of snappy bottles available. You'll fill out the label and then put it directly on the bottle, and then we have some plastic bags to slide it into, and then you'll give it to your bedside nurse and she'll be able to put that away. So this is one of our pumping rooms. We have two here in the NICU. This pumping room in Pod 2 has a refrigerator with juice and some crackers. You're always welcome to come here. We currently have Amita pumps. If you don't have the pump parts for that, do not worry. We have those here for you. Or you're always welcome to pump at the baby's bedside. Many times families prefer that because they're able to get more milk that way. But either way, we're here to support you in making that breast milk medicine for your baby. This is the end of our tour of the NICU. I'm so glad I had a chance to show you around before you get to come here and actually visit your baby. But I know I might have brought up more questions that you hadn't even thought of. So just to let you know that we have a whole team of people here that are here to answer your questions, and we will all get through this together. So we look forward to meeting you and look forward to that fantastic day when everybody will be home as a family again.